Hi everyone. So we are going to discuss the common mistakes and reasons for failure in the ADC exam, both with respect to the written exam as well as the practical exam. All right. Now, my name is Dr. Raza Abbas Bangash. I'm an ADC certified and APRA registered dentist, actively working in 3 practices in Australia. I have 10 years of experience teaching ADC candidates both for the written exam as well as the practical exam. And we had a huge amount of candidates pool who have cleared the exams, the written and the practical, and who are practicing currently in Australia. All right. So, based on this experience of teaching thousands of candidates, we have formulated the most common reasons that we feel that the candidates make in the written or the practical exam, leading to a failure in the exam or a substandard score, again leading to a fail in the cluster or the entire exam. All right. Now, it's important for you to know the profile of the person that you are listening to today, of course. And if you enroll and join our courses, you should know who's teaching you or who's mentoring you. Why? Because with the advancement of technology, social media platforms, it's very difficult for the candidates to know who is real and who is fake. And unfortunately, that's what is happening on social media because a lot of candidates do come to me and they ask me that there is so much going on different social media platforms. I'm too distracted. I'm not really sure what to do. There is so much advice. I'm not really sure whether it's a correct advice or it's not a correct advice. So, how do I draw a line where I can feel that the person who's guiding me is reliable or the person who's guiding me has actually gone through the same process? Now, the easiest way that I'll give to all these candidates that question me or send messages to our academy is to try to search for your mentor on the APRA website. All right. So, the Australian Health Practitioner Regulation Agency has a website, and your mentor name should be on that list. If you are being guided by someone, if you're joining any courses for the written or the practical exam, your mentor's name should be on the APRA registered dentist list. All right. What does that mean? Because if your mentor name is going to be on the APRA registered dentist list, it means that they have cleared the ADC pathway, both the written and the practical exam, and that is someone that you can rely upon. All right. Of course, you can search for my name as well and you'll find me there. But any mentor, any academy that you join, irrespective of whether for the written or the practical exam, make sure that they have cleared the ADC themselves. They have the ADC certificate with them, they have the APRA registration with them, and they are mentioned or listed on the APRA registered dentist list on the APRA website. Because a lot of mentors, educational institutes, they have not cleared ADC. They have not gone through the same pathway that you're going through. So there is no point in learning from someone who has not done something themselves because you will never do anything in your life or you will never learn something in your life from someone who has not gone through the same thing themselves, right? You will never learn driving from someone who has not driven a car before. You will never learn swimming from someone who doesn't know how to swim. So, why are you depending on someone who has not cleared the ADC exams themselves? This is the most important part of your journey. This is the most, or probably the most toughest part of your life, clearing the ADC exam. So, why would you want to depend on someone who has not done it themselves? If they have not been able to complete the ADC journey, if they have not been able to be a registered APRA dentist in Australia, how do you think that they are going to make you capable of achieving that? All right. Now, I'm not pointing fingers at any academy or any person as specific. I'm just generally mentioning how you can vet your selection process. Because if you see someone or if you plan to join someone, make sure that you ask them to show you your ADC certificate. All right. The mentor should be able to show you their ADC pass certificate. Secondly, even before asking them, just visit the APRA website and type on the name of the mentor or the academy that you're joining. The name of the mentor should be there on the APRA website. If it is not there, please make sure that you take utmost precautions by joining anyone who has not gone through the journey themselves. There are hundreds of academies, hundreds of mentors these days. A lot of them are on social media. Social media is a double-edged sword, basically. It can benefit you and it can harm you. All right. And a lot of times it's the harm because the messages that we get from the candidates, we do realize a lot of them are being misguided. All right. And it's not actually their fault because when you have thousands of advertisements on daily basis on Facebook, on Instagram, on different websites, some of them are even paid. So it's very easy for the candidate who unfortunately is a beginner at this stage to fall for all these things. And you need to be clever enough to make sure that you are guided by the right person. Like I said, the process for you to know who are you being guided by is to go through the APRA registered dentist list. So make sure that whoever you join, they have to be an ADC qualified and APRA registered dentist currently working in Australia. And there are many reasons for that because someone who has not gone through the journey, someone who doesn't know the day-to-day clinical implications of working as a dentist in Australia, unfortunately, they cannot guide you to help you clear the ADC exam. All right. All right, so let's go to the next step on the main purpose of this video. So we have a few other important videos that we have added, which the first one is this one, which is basically the ADC journey from initial assessment to the written exam, the practical exam, and once you clear the practical exam, how do you register with APRA, the visas, the immigration process for candidates who are outside Australia. So I mentioned all that in this particular video. I'm pretty sure it's on our website and our Facebook page, so make sure that you go through it. And then we have another important video over here, which is the common mistakes during the practical exam leading to a substandard score. I think all the candidates who are enrolled with us in the practical exam course, they have access to this video. So make sure that you do watch it because all of these videos are basically a part of the series and more videos will come up. Okay. All right, now let's go to the next important step. Now, you will see a lot of candidates telling you, ADC is not possible. Please don't take that pathway. Okay. Now, it's very important for you to understand that unless you believe you can pass the exam, no one else can make you believe that. And then it goes on to say, if you don't believe you can pass the exam, no one can make you believe you can. Now, these are really important lines that you need to remember. Before you start the ADC journey, or if you are currently in the ADC journey, you have to have that belief that you can pass the exam. No one can make you believe that. If you feel that, no, you see, the exam is so difficult and a lot of candidates do fail this exam, I can't make it. I can't pass the exam. So if you have this belief, then it's difficult for you to get yourself out of this belief and prepare yourself comfortably to pass the exam. And the other thing is that if you don't believe you can pass the exam, no one can make you believe you can. No mentor, no academy, and no relative, parents, friends, siblings, they cannot make you believe because it's your journey. It's your obstacle that you need to clear. So you need to have this belief. Of course, it is tough. It is a lot of hard work that is required. The pass rate is quite low, but that does not mean that you can't do it. Like I mentioned earlier, we had roughly around 1,500 candidates who have cleared these exams with our academy only, with the courses that we run. So if they can do it, you can do it as well. So the first important thing is the belief that you need to have in yourself. Now, please remember when I say believe, it doesn't necessarily mean that it has to be in the first attempt. That's something that you need to remember. Consistency is the key. If you're not able to clear the exam in the first attempt, that's fine. That's okay. It's not the end of the world. It's not the end of the life, right? You can always work on your mistakes and clear the exam in the second attempt. A lot of candidates do it. Out of these 1,500 candidates who have cleared with the academy, majority have not cleared in the first attempt. There is no lying, or I'm not a kind of mentor who wants to, tell lies and fabricate stories. A lot of these candidates that we had who have cleared with the academy's help have cleared in second, third attempt even. Because this is the consistency, because of the exam environment, the stress, the amount of hard work that goes into it, sometimes good candidates, well prepared candidates, are not able to make it in the first attempt. That's perfectly fine. There's no harm in that. And you can always get back, refresh yourself, get to know what mistakes you are making, get to know where you are lacking, whether it's the written or the practical exam, and get back to the journey. All right. So consistency is the most important key that you need to remember. We had a lot of candidates who have cleared both the exams in the first attempt, but that does not mean that you start comparing your journey with them. Everyone is different in this journey. Every human being is different. The way you perceive knowledge, the way you prepare yourself is going to be very different, especially for the practical. It's going to be entirely different. So you can't compare your journey with someone else. If someone cleared the exam in the first attempt, good for them. If you're not able to do it, that's fine. Always try to make sure that you work on your mistakes and get the second attempt. If not, get the third attempt. And also, it goes vice versa. If someone has not been able to clear the exam in the first attempt, it doesn't mean that you are not able to do it. Their journey is their journey. They didn't clear the exam in the first attempt. That's fine. Maybe you can clear the exam. Don't go with a belief that this exam is hard and it's not doable in the first attempt. Of course, it's doable. The person you're listening to today has done it. A lot of candidates we had in the academy have done both the exam in the first attempt, the written and the practical. And you can scroll to the academy's website, academy's Facebook page. You will find a lot of names. Maybe some of them are your friends even. So go with this belief that every attempt that I give, whether it's my first or my third or my fifth attempt, give your best, be consistent with your preparation. Don't take the preparation lightly. That's the biggest harm that you can do for yourself by taking the preparation lightly. All right. Now, coming on to the next important question, the ADC fails candidates. Now, sometimes we get these useless types of questions from a lot of candidates. You see, I've been practicing in Australia for a long time. I've been teaching candidates for a long time. I got an offer to be an examiner for the ADC as well, but I was not able to execute that because then I have to stop mentoring because there is a conflict of interest. So, does ADC fail candidate? No. ADC will never fail a candidate, but let's rephrase it. ADC will never fail a passing candidate. All right? It becomes easier for you to understand. ADC will never fail a candidate who's passing the exam. A candidate who's failing the exam is failing the exam. But a candidate who is passing the exam, ADC will never fail them. Now, what do I mean by a candidate who's passing the exam, right? A candidate who's passing the exam means, for the written exam first, a candidate who is well prepared, who knows the clinical implication of dentistry, who takes the knowledge not only as a theoretical component, but include that in the clinical component on day-to-day practices that happens in Australia. For the practical exam, knowing the rubrics, the most important thing, knowing the ADC marking rubrics. Secondly, knowing how to communicate in a clinical setting. All right. That's the most important thing. I'll get to the details of both the written and the practical exam very shortly. But to answer this question, does ADC fail candidate? No, they do not fail candidates. Yes, the passing percentage is low. The exam is tough. They don't pass a lot of candidates, but that does not mean that if you are well prepared, you have done well in the exam, you have executed the task according to the expectations of the ADC, they are not going to fail you. All right. So please remember that ADC never fails a candidate. Candidates fail the exam because of their performance. Now, it's up to you whether you know those mistakes that you made or whether you do not know those mistakes that you made. That's a different story. But that does not mean that ADC fails candidate. A lot of candidates fail the exam in regards to a lot of mistakes that they make in the exam, especially the practical candidate, and they think they did well. But the truth is that they did not do well, and that's why they failed the exam. All right. Okay, now let's break it down to the written exam and the practical exam. All right. Now, the written exam, it's an assessment format, is designed to provide you with an opportunity to demonstrate you know how to practice dentistry in Australia. This is a very important, significant point. To demonstrate you know how to practice dentistry in Australia. Now, coming back to my earlier point when I mentioned, you should be learning from someone who knows how to practice dentistry in Australia, because it's very different from a lot of countries. The way dentistry works in Australia is a lot of different from the way it works in subcontinent, in Australia, in United Kingdom, in Gulf countries. It's a lot of difference. All right. So it's an opportunity for you to demonstrate you know how to practice dentistry in Australia. Okay. So that's one of the most important reason when you're learning from someone, when you're getting enrolled in any academy's courses, you know whether they are by themselves practicing dentistry in Australia. Because if they are, then only they will know. No amount of books, articles, journals is going to help you with that, because you don't get this information in that. It assesses your application of clinical judgment and reasoning skills relevant to the dental practice in Australia. Now, both these lines, the first one and the second one, are from the ADC written exam handbook. All right. So this is what the ADC is actually expecting from the candidates for the written exam. Your application of clinical judgment and reasoning skills relevant to the dental practice in Australia. It's not all about theory. It's not all about books. It's not about chapters. It's not about all these lengthy textbooks. Yes, ADC has a reference list. But you see, just going through textbooks is not going to help you clear. Maybe if you are lucky, you might be able to. But a lot of things happens in the written exam with regards to the clinical situation, how you are executing the case based on the clinical judgment. For example, you're extracting a tooth. It's 5 p.m. And you're extracting a tooth on a Friday evening. Saturday, Sundays, you're off. You're extracting the tooth fracture. One of the root fragment is there. You're not able to remove it. What are you going to do next? These are the types of questions ADC asks in the exam, right? And these are very interesting questions, because this is actually what happens day-to-day life. You might be a very good practitioner, but it's your bad day. You're not able to do extraction. You have done thousands of them, but that day you are extracting the tooth, you fractured. 5-6 mm of the root fragment is there. You tried, you're not able to remove it. What to do next? So you see, it's so much of clinical judgment. What are you going to do next clinically? Books will not tell you this. Articles, journals will never tell you this, because it's not their fault. It's not the fault of the books or the articles or journals. It's basically because they give you theoretical knowledge. They don't execute the knowledge that they contain in a clinical environment. Okay. Now let's come to the second part. The question asked in the written exam are very, very important to the day-to-day procedure dentists perform in Australia. So the questions that you have in the written exam, especially the new format, since it changed from 2021 onwards, the new format is completely clinical based. It doesn't have to do anything with the theoretical component. What I mean, of course, theory is important, reading is important, going through textbooks, articles, journal, books, those things are important. We have included them in our course. We have a lot of notes that I have personally fabricated, which are included in the course. But it's very important, because all these questions that you see in the written exam, every case scenario is basically something that you will see once you start practicing as a dentist in Australia. Once you clear the ADC exam, get registered with APRA, when you start practicing dentistry in Australia, you will realize that all these things that the ADC was trying to ask us in the written exam is actually what I'm seeing on my day-to-day basis. For example, patients with multiple complex medical history. You will see a lot of patients over here who have a lot of medical conditions, taking a lot of medications, multiple medications, old age patients, marijuana patients, a lot of patients you will see consuming marijuana, consuming cannabis. I had a patient 2 days ago for extraction. This patient came to me and he was he told me, he was very open and frank with me. He said that I consumed cannabis just in the car before seeing you, which probably was like 5 minutes before, and that patient was scheduled for extraction. Of course I did not do the extraction for him because there are certain reasons we have to wait for 6 to 12 hours after the consumption because we are giving LA with adrenaline, right? And then alcohol, vaping, smoking, abuse, patient dissatisfied with previous treatments, complaints, etc., and so much more that we actually cover in the mocks of our course. Now, every patient I see here in Australia, the patient fills in the medical form and medications chart first, and sometimes it actually takes 20 to 30 minutes just going through it. Now you understand why ADC frames questions this way, as you'll be seeing these patients in your day-to-day practice in Australia, and there is no margin of error with these. Why? Why this is so important? You will see questions in our mocks, in our courses, the live mocks we conduct, the questions collection we have. You will see cases with patients who are diabetic, who are having osteoporosis, who are having high blood pressure, consuming blood thinners, anti-resorptive medications, antiplatelets, anti-diabetic medications. These are so important because you actually start seeing these patients. Like I said in the first statement, opportunity to demonstrate you know how to practice dentistry in Australia. So this is why ADC asks questions which are very complex, but all these questions are basically day-to-day procedures, day-to-day patients that you will see once you start practicing as a dentist in Australia. And that is what ADC is preparing you for. So anything that you studied during your BDS, during your college or degree, that was all theoretical, which was very easy. When you come to the ADC journey, it's not difficult but different because it wants now the clinical implication of what you have studied. You know what diabetes is, you know what diabetic medications are, but now ADC does not care about that. ADC cares that you are scheduling a patient with an acute odontogenic infection. He has uncontrolled diabetic. What should you do? ADC wants to ask you questions like these. Patient is diabetic, hasn't seen the GP for the last 2 years, does not measure their blood sugar levels. The blood sugar level is not in control. You're scheduling a procedure. What precautions you need to take? What is the normal HbA1c that is safe for you to proceed for extraction or any other procedure that you're doing which is invasive? Place patients on blood thinners. What precautions need to be taken? What blood thinners have significant role depending upon the risk of procedure, whether the procedure is at a greater risk of bleeding or at a lower risk of bleeding. This is how ADC asks questions. They don't care about the basic knowledge. They want you to implement that basic knowledge in a clinical outcome. All right. That's why the exam I mentioned earlier in one of my videos, the exam is very interesting for candidates who lack the clinical implication of dentistry because the exam is not boring. It tests everything, every question in the exam. All 240 questions that you have in the exam are related to the clinical aspect that you will actually be doing once you clear the ADC exam. All right. All right. Now, certain other points that we personally, me, has felt when the candidates prepare for the written exam, over reliance on rote memorization instead of conceptual understanding. Like I said earlier, rote memorization is basically what you did for your BDS degree in your college. Forget about it. Nothing to do with ADC. Difficult interpreting Australian context, guidelines, protocol, and ethics. Like I told you, ADC wants you to know how to practice as a dentist in Australia. They don't care what the other guidelines say. You have to follow ADC protocols, Australian standards, ADA standards, APRA standards. That's what you need to follow. Overconfidence in theoretical knowledge, neglecting clinical evidence-based dentistry. Again, a very important point. Candidates sometimes come to us, especially these candidates from subcontinent. They tell me that, I was the topper of my class. I have gold medalists in these subjects, and they tell me that the ADC exam will be easy for me. Now you see, like I mentioned, ADC has nothing to do with your dentistry degree. All right. It's only the clinical implication of what you have studied. Yes, if you are comfortable with the clinical aspect of that theoretical knowledge that you used to study in your BDS or degree or college or university, then it's good. But just having good theoretical knowledge, whether you're a topper, whether you are a gold medalist, whether you stood first, that all does not matter. Your theoretical knowledge needs to be converted into clinical aspect, clinical evidence-based dentistry. Superficial knowledge, unable to apply concepts, only memorized facts. Like I said earlier, lengthy books, studying them, memorizing them. Of course, to some extent, of course, you need to have understanding. Understanding is important, right? But memorization, learning word by word, line by line, nothing to do with ADC. Failure to align with Australian guidelines, infection control, radiography, prescribing, ethical, legal frameworks. Very important. And that's one reason you should always learn from someone who's practicing as a dentist in Australia. Why? Because the infection control, radiography, prescription, legal framework, legal cases, indemnity insurance, all these things are to be known from someone who's actually working in Australia. It's very different for every country. Australia is very strict with the legal framework. Australia is very strict with infection control. Australia is very strict with violations. So you should know these things based on Australian context, not in context of a general guideline. Misinterpretation of clinical scenarios, choosing unsafe or outdated treatment plans. Now, again, this is important. Why? Because you will see, let's take a very basic example, patient with diabetes, right? Now, you will see different textbook, different guidelines, different authors mentioning a different approach for it. Your approach should only be with respect to how things are followed in Australia. The best example for that is therapeutic guidelines, ADA guidelines, ADA journals. And in our course, we have included certain things that I have personally made them to help you, the candidates, with how to cope up with these scenarios in a day-to-day practice, how we do it here in Australia. So your information should be only based on the relevant clinical treatment plans that we make in Australia. All right. Why? Because sometimes when you're going through the ADC exam, ADC questions, you will see that multiple options seem to be correct. For one question, there are five options, right? And you will see that there are few options. All of them make sense. But of course, the answer is only one, right? So that's the reason sometimes certain textbooks do mention the other option as correct, but Australian guidelines say, no, that's not correct. That's what it's very important for you to know a safe and up-to-date treatment plans, not outdated treatment plans. Neglecting patient safety, wrong drug doses, poor emergency management. Again, very, very important. Like I said, there is no compromise on legal framework, medical emergency, prescription, doses, drug prescription, on complaints policy, ADA policies, bloodborne viruses, infection control. There is no compromise. Bias towards home country practices rather than evidence-based dentistry. Again, a lot of candidates who are practicing as a dentist in different parts of the world, they are more inclined towards practices that they are doing there. But like I said, Australia, ADC, written exam, practical exam, is completely based on what it's done in Australia. Inconsistent knowledge, strong in some topics, completely blank in others. This is also sometimes we see the candidates are very strong in one aspect, let's say operative dentistry and endodontics, but they're completely blank, let's say in infection control, in periodontics. But in real life, you might get away with it. But for the written exam, you have to be solid with respect to everything that is going to be asked for in the exam, right? You can't pick and choose that, okay, I'll prepare this and I'll neglect this. That doesn't happen because you'll fail that topic, you'll fail that cluster, and unfortunately, you'll fail the written exam as a whole. Inability to prioritize, failing to identify urgent versus elective care. This is also so important because sometimes you will see question in the ADC exam telling you what you will do first, what should be done for the patient first. A basic example, patient coming to you with pericoronitis, you can't extract a tooth. The patient has infection, pus swelling is there. What you will do for the patient today? What home care instruction that the patient should follow as a priority? You see a lot of these questions in the ADC exam. And for you, you need to identify what can be done to help the patient get out of pain, help resolve the patient's symptoms. That's the most important thing. Because although the written exam is clinical based, but the patient focused is very important, right? For example, this patient, like I mentioned, for pericoronitis, you tell the patient you have a swelling. I can't extract the tooth. Come to me after a week. Give him antibiotics and that's it. Practically, it's acceptable, right? But you have to do something more. Do initial drainage. Use hydrogen peroxide, chlorhexidine. Debride the pocket, clean the pocket, remove the calculus. Help the patient have warm salt water rinses at home. So you see how you can prioritize treatment. And it goes for a lot of different clinical conditions, clinical treatment plans. And then we have mocks in the course. Candidates fail them not taking it seriously, not timing themselves. Exam feels super hard. Again, a lot of common reason why we see, because we conduct a lot of mocks. We have a lot of mocks in our course. We make it easier for the candidate because we understand we have candidates all across the world. And we do respect their time because I'm in Australia, candidate who's in India, who's in Pakistan, or who's in the Gulf country, or anywhere who's in the UK, they're probably behind us. So a lot of sessions that we conduct it according to Melbourne time. But the problem is that these candidates, although I try my best to make sure that access is available to them anytime they want, so they start taking it lightly. They don't time themselves when they're doing the mocks. They don't take it seriously. They don't take it as a mock. They start going to the answer key first and then do the mock. Now, you see, you can do all that, but there is a reason why we follow, why things are done certain way, right? We conduct the mock, then we have a discussion, then we upload the answer key. Why? Because we want you to feel that exam environment that you will have on the day of the exam, right? Because without that, the exam might start to feel super hard. And we have a good ample number of candidates who will fail the exam because of time management issues, not able to go through the cases completely, feeling overwhelmed, getting to having to do 4 papers on 2 days of the exam. So it all counts. It's not only the preparation. Everything counts with this exam. Stress control, time management, how you're going through the cases. And the last important point, I believe, dependency on mentors. It's your exam, it's a licensing exam, it's your success. You're a dentist, you're not becoming a dentist after ADC. Now, you won't see us advertising so much on Facebook or social media or Instagram. Why? You see, the thing is that I always try to keep things real. I always try to keep things factual. You don't need to depend on your mentor so much. Of course, if you get enrolled in our course, we'll provide you with our support. We'll provide you with all the material. We'll provide you with all the relevant data that you need to go through. We'll conduct mocks. We'll conduct sessions. But you can't depend on a mentor totally. It's your preparation. It's your journey. It's your hard work. Anyone who enrolls in our written or practical, I'm not going to message you every morning, 8 a.m. Are you preparing? No. If you're not serious about the preparation, like I said earlier, the first thing that I said, this, unless you believe you can pass the exam, no one else can make you believe that. If you don't believe you can pass the exam, no one can make you believe you can. So, a mentor, especially me, I will not be running after you. I'll give you everything you need to ace the exam. I'll give you everything that you need to pass the exam. But if you're not serious about it, if you're not taking it seriously, if you're not dedicating time towards the preparation, then irrespective of any mentor you join, success is the exam is going to be hard. And lastly, this last statement is important. You're a dentist. You're not becoming a dentist after ADC. A lot of candidates I see with a lot of childish behavior. They behave like kids. Please remember that you are a qualified dentist. You are a dentist in the country that you are currently residing in. You're a registered dentist. You have completed a degree. Don't make anyone make you feel that you're a kid. All right. I don't even like to call the students that are with me in the course as candidates. I like to refer to them as dentists, as doctors, because You don't want someone to make you feel inferior. You are a dentist, yes. You're not a dentist in Australia yet, but you will be one day, right? So I don't like the giving this feeling to everyone who's preparing for the ADC that they are not a dentist. You are a dentist. You are a dentist, practicing dentist. Some are practicing for 10, 15, 20 years. So don't take that credibility away from you. Of course, you're not dentist in Australia. You're preparing for it. You will do it. You will become a dentist in Australia. But don't let anyone treat you like a kid, like a child. Okay? All right, now let's go to the next section, I think practical exam. Yeah. Now let's go to certain tips. Although I have a lot of these videos in the practical course that we run, but certain basic points that I feel that needs to be addressed. Time management issues, running out of time in clinical or technical tasks. A very common reason that we see, especially for the technical day of the exam, you have 6 tasks that you need to perform in the mannequin. I always ask the candidates, please practice by timing yourself because the exam day feel is very stressful. So if you are not timing yourself when you're doing the tasks, it becomes difficult for you to cope up with that on the day of the exam. Lack of practice on typhodones, mannequins with ADC standard equipment, always try to practice with the instruments, the materials, the burrs, the teeth that the ADC is going to use on the day of the exam. Okay? Because it makes a lot of difference if you are not going to do it because you don't want something new on the day of the exam because the exam by itself is so stressful. Not rehearsing infection control sequence properly, PPE. Very important. A lot of candidates start to feel that the PPE on the day of the exam can be a bit overwhelming. So when you're practicing these tasks at your home setup, at your clinic, please make sure that you do it with strict reference to the PPE. Practice every task with PPE. Make a framework in your mind how you're going to do the PPE on the day of the exam, how you're going to wear it, how you're going to remove it. You need to know because this mental map helps you, especially with the technical OSCEs in the clinical day of the exam. Over preparing on one section and neglecting others. Again, very commonly we see candidates try to master crown preparation and they feel, okay, that's done. Everything is done. But that's not how it works, right? There are 5 other tasks. So you need to make sure every task you do according to the ADC marking rubrics, according to the ADC standards. And it makes us feel very sad, especially I get a lot very sad when candidates pass the entire day of the exam, but because of one station or one task, they fail the entire exam. That happens a lot. Candidates are well versed with, let's say, crown preparation, caries preparation, and they don't know how to do amalgam. They fail the amalgam, fail the exam. It happens a lot of time. So make sure that you're prepared for all sections of the exam, not over preparing for one section. Overconfidence, thinking practical will be easy compared to written. That's true. Practical is knowledge wise, content wise, less compared to the written. But execution wise, it's very hard because the marking rubrics are very, very strict. So please don't have this confidence, although the number of tasks, the number of amount of learning that you are going to do is going to be a bit less compared to the written. But perfection needs to be achieved. Execution needs to be achieved. Unfamiliarity with marking criteria, not knowing what the examiners are looking for. Again, blindly practicing the task is not going to do you any good. You need to practice the task. You might be a prosthodontist doing crown preparation daily, but we have seen a lot of prosthodontists failing the crown preparation on the day of the exam. Why? Because ADC has a marking rubric on which you are marked. If you meet that, okay, your task is passed. If you don't meet that, no matter how good the crown preparation is, it's not going to pass the task. Unsafe clinical practice, breaching infection control or cross contamination. That's why it's so important because the stress of the exam is so much. You're doing so many tasks. It becomes difficult for you to follow the infection control. So you need to know, you need to practice in your home setup or clinical practice in regards to PPE, in regards to how you're going to avoid cross contamination, dirty area, clean area, your bracket table, how you're going to follow the path. If you need, for example, you need something from the drawer, you need something from a clean area, how you're going to follow it, what is the sequence. This should be in your mind. A mental map should be created so it becomes easier for you on the day of the exam if you come across certain situation. Failure to demonstrate competency across all domains, candidates strong in one area but weak in others, the same thing. We'll see candidates passing certain cluster, but because of weakness in the other cluster, a task in the other cluster, they fail the exam. So it always have to be preparation for all tasks, technical, OSCE, communication OSCE. There is no margin of error because there is no room for error. Yes, certain mistakes here and there are acceptable as long as they are clinically acceptable. But if it's beyond that, it's not acceptable. Inefficient technique, wasting time. Again, you see, there are a lot of ways to do tasks. There are a lot of ways to do communication OSCEs. There are a lot of ways to do the technical tasks. But you need to see which one is an efficient way of doing it so that it saves you time, so that you have time for other tasks, because you never know how the day of the exam goes, right? Especially the technical day. You might not be able to execute it as you're executing it at your home center. So you need to follow a method that is efficient, helping you achieve the rubrics and saves you time. We have a lot of videos that I have personally made for different tasks of the practical exam. That is my way of doing things. And I always tell the candidates, please remember, this is my way of doing things, but that doesn't mean there's no other way of doing it. As long as the outcome is achieved, it doesn't matter how you reach the outcome, right? If the outcome is fine, if your task is meeting the marking rubrics, it doesn't matter how you reach there. But if you can reach there quicker with an efficient technique, that's always rewarding, right? Inability to justify treatment choices in OSCEs. Now, like I said earlier, these exams are clinically oriented exam. Sometimes when we have communication OSCE sessions with the candidate, they start telling me, you know, like for example, because I act as a patient when we do communication OSCEs, they start telling me, we can do this for you, this for you, this for you, this for you. What should I do with that? Are you able to justify that? If you're taking a tooth out for me, can you justify that? Give me advantage, disadvantage. If you're not taking it out today because of certain medical condition or medication I'm taking, justify it. I heard a lot of patients telling me, we can't take your tooth out today because of the uncontrolled diabetic status. What should I do with this information? Examiner is going to mark you down. Uncontrolled. I know my diabetes is uncontrolled. I have not been following my GP. I'm not taking my medication. You're not giving me new information. Because of my uncontrolled diabetic status, you're telling me you can't take the tooth out. I want the reason. I want the reason. If you want to pass the exam, you have to give a reason. I can't take the tooth out because it's not what happens during the procedure of extraction. It's what happens after. Delayed healing, chances of infection, which can be quite bothersome, leading to multiple visits, leading to complications, leading to hospitalization. We don't want you to go through all this. We like to practice safe standards of dentistry. This is your reasoning. This is what the examiner, which is acting as a patient, wants to listen, right? Failure to adapt to Australian context, communication, consent, medical legal responsibility is very important. The way you communicate, reassuring the patient, showing empathy, showing sympathy, understanding their point of view, involving them in discussion, knowing their point of view, knowing their ideas. If they're coming for personal treatment or a selected treatment plan, what is the reason why they selected it, knowing their knowledge and then communicated it. Always remember, it's a two-way communication, not a speech. Poor professionalism, lack of respect, inappropriate behavior, poor patient interaction. Now, a lot of time that we see when you do sessions, candidates start speaking, and the examiner, uh, or the patient, when we do the cases, and just listening. That's not how communication OSCEs work, right? If it's a communication OSCEs, you need to follow up with the patient. Are you happy with the treatment plan? Is there anything that's concerning to you that you would like to discuss further with me? Do you have any questions so far? Would you like me to repeat something? So this is how you interact with the patient, involve them, know their point of view. That gives you more score. But please also remember, every case, you are being marked for the knowledge, of course, and then a communication as well. So both are important. Not demonstrating minimum safe standard. Exam is about competence, not perfection. Again, like I said earlier, a couple of points earlier, you don't need to be perfect. Your task does not need to be ideal. It needs to be competent enough that a normal dentist who's working in Australia is doing it. A competent dentist. That's what the ADC is looking for. Certain times, that's why I say the marking rubrics are so important that let's say that you are doing an amalgam restoration, right? You have done it really well. Your contacts are fine. Tooth restorative junction is fine. Cusp height is fine. It's in occlusion. You have certain areas which are rough. Examiner is never going to fail you for that. You will pass that task because your task is clinically competent, is clinically sufficient. We don't want perfection. We don't want ideal criteria. If it is clinically sufficient, which means that this restoration that you do, if you do it in a patient, it's going to be fine. That's fine. Minor roughness is not going to cause you problem. But yes, let's say you did the amalgam task. You did everything beautifully, but one of your contact is not there. That's restoration is not clinically competent now, right? Because there's going to food impaction, localized gingivitis in that area. So that's how the examiner thinks, right? Please remember, examiners are clinicians. They are practicing dentists in Australia. Case information not followed. Case is saying referred, but you say, I want to do it. Again, very commonly we see when we do the sessions, the case is telling you refer the patient to a specialist for so and so procedure. You start to do, what we call it as someone mentioned the other day, I was reading, herodontics. You don't need to do herodontics. If the case is telling you refer, refer, then please refer. There is no reason for you to do the treatment. But yes, giving them a justification why you can't do it and what is the reason for the referral and what is expected of the specialist to do in your case. Not following what the case is about, they don't care how knowledgeable you are or how much information you give. Unless it is relevant to what the case is asking, it's not helping you in any way. Now, again, this is a very important, like I said, ADC examiners don't care how knowledgeable you are or how much information you're giving it, unless it is relevant to what the case is asking you. That's where you are helping the patient with their concern, right? For example, irreversible pulpitis. You know what irreversible pulpitis is, you know the definition and all that. Doesn't matter. You need to tell the patient what is happening, how it is affecting, and how it has led to the symptoms that you have, and what treatment options we have. That's what counts. When we assess candidates' technical tasks, very, very few meet the rubrics. Now, again, an important point. Like I told you earlier, ADC does not fail any candidate purposely. And we assess a lot of technical tasks. When we assess the task, 90% of these candidates are not meeting the marking rubrics. These tasks will not be pass tasks on the day of the exam. So when you're not able to meet that criteria, when you're practicing at the home setup and you're sending us work, how do you think that you met the criteria on the day of the exam? And then these candidates come back and say, we failed the exam. Yes, you failed because you did not meet the rubrics. It was not that the ADC was failing you, right? When we hold communication OSCE session, very few will demonstrate clinical competence. Remember, it's not a speech, it's a two-way communication. Always think if you were the patient, will you be satisfied? This is a very important statement. Now, I always tell the candidates, so once they present the case to me, and if the case is substandard or not really well presented, I tell them, let's reverse the role. Imagine this was me and you were the one who were assessing me. If I presented the case to you this way, would you be satisfied? Would you be happy? Think both ways, as an examiner, as a patient, then tell me. Because if you're not satisfying the patient for the reason why they are here at your practice today, examiner is not going to hesitate you to mark you down. Patient satisfaction is very important. Now, please remember, there is a difference between patient satisfaction and patient agreement. You don't have to make sure that the patient agrees with what you are saying. There will be instances patient is not happy with your treatment plan. Patient wants something else to be done. That's a different story. As long as you stay factual on what you are saying and stay clinical relevant, that's important. Patient is happy, or patient is not agreeing with your treatment plan, or the patient has certain treatment plan that they have bought into you and you are not happy delivering it, those are separate stories. You don't have to involve yourself with patient agreement. It doesn't have to be whatever you say the patient should be agreeing to it 100%. No. But if you are not agreeing, the reason for that. If the patient wants a specific treatment plan, you're not agreeing to it, the reason for that. That's important. Because like I said, there are more than one ways to do things. As long as it's relevant, factual, and clinically important and clinically relevant, it's perfectly fine. Taking patients' autonomy away happens very frequently. Why? We see candidates telling us, when we are doing the session, this is what we can do for you is we can start the root canal procedure. The first appointment will involve drilling a hole in the toe, accessing the nerve, and then taking the infected nerve out. Won't you ask me if I'm happy to go ahead with the treatment? Present the treatment options to me, no treatment, RCT and extraction, let's say, and then tell me what would you like to go ahead with. Ask me, involve me in the discussion, right? If you start choosing the treatment option for me and then telling me what you will do, you're basically enforcing your preferred treatment plan on me. That was not my preferred treatment. What if I don't have money? What if I'm short on time? What if my financial capabilities are not enough to pay for the root canal and crown later? So involve me in the discussion to see whether I would like to go ahead with the preferred treatment plan that you're giving. Enforcing your preferred treatment plan onto patient without patient involvement or missing other treatment options which are also applicable to patient condition. Now, again, for example, you have a case where, let's say, the patient has a discolored tooth and you try to go with, let's say, direct composite veneers. But why only direct composite veneers? Give the patient all the options, short term, long term, advantage, disadvantage. Let the patient select because it involves both things. One is, first, of course, in every station you have to give all treatment plans. Secondly, if something goes wrong with this patient, they are not happy, maybe weeks or months after the treatment, and they come back to you, you don't have anything to defend yourself because you just gave them this one option which they selected. If you have given them all the alternate treatment option with advantage and disadvantage and let the patient decide what they would like to go ahead with, you can save yourself as well, right? And always remember, whatever you tell the patient ahead of time, it becomes a reason. Whatever you tell the patient after it has happened, it becomes an excuse. Asking question as if reading from a script, yes, no, yes, no. Again, this is something that I hate a lot when the candidates start asking question, like let's say patient is in pain. Do you have sensitivity? Is the tooth hot sensitive, cold sensitive? Is there pain on biting? Because all these questions lead to yes, no, yes, no. I want you to involve me a bit of discussion. What brings the pain? Can you please tell me a bit more about the pain that you're suffering from? Because when I'm answering this or when the patient answers this, they're not going to answer in yes and no. They're going to give you a brief description. That's called as an open-ended questioning. Assuming and not staying factual. Again, very important, especially in cases of angry patient, complex treatment, complaints issues. Always stay factual to the data that you have. For example, we have this case in the practical exam. The patient has an aphthous ulcer, right? So the patient sister has celiac disease. So the candidate tells that, it's good to see a GP because I think you might have celiac disease. Complete straight fail. There is no point of recovery from this. Why? You don't convey information this way. You can tell the patient that it's a good idea that you have a check with your GP because you mentioned that your sister has celiac disease. Certain medical conditions do run in families and they have genetics and family history to play a part in. So it's a good idea to have a check with your GP just to make sure there's nothing that's involving you. This is how you convey. Factual. You can't throw a medical condition onto a patient. How would you feel if someone tells you that you have this disease without even confirming it? So there is no margin of error here, straight fail. Thinking as a dentist and not a student. Again, ADC wants you to think as a dentist, not as a student. Please behave as a dentist in the exam. when you're conveying your treatment plans, when you're doing the treatments, when you're giving advantage, disadvantage, when you're answering the patient queries, always behave as a dentist, not as a student. ADC does not want students, they want dentist. Examiners do not have time. You have to be on time, on point, and satisfy them in the time you have. Now, again, because you have limited time during your communications, or whether the technical or technical ask is, examiners do not have the whole day to assess you. They have that limited time frame that has been allocated to you. You need to satisfy the examiner during that time. That's one of the reasons why a lot of good candidates fail the exam, because they are good, but they're not able to justify their goodness during the time frame that they have. And that's why practice is so important. Practicing, practicing, practicing. And then the last, and one of my favorite statement, they want clinicians, not professors. It's an exam after which you will be allowed to practice in Australia. Again, this is such an important thing, right? Because you are not going to pass the ADC exam and become a professor in university. You're becoming a clinician. The exam is giving you a license to practice as a dentist in Australia. Once you're a dentist, you can be practicing in a clinical setup or wherever you want. But this exam makes clinicians, not professors. That's why it's so important that everything that you do is relevant to the clinical day-to-day practice in Australia. That's what the exam is preparing for you. Professors is a different thing. Theory, if you're strong, become a professor. Get to university, start teaching students. But this exam wants clinicians. Once you clear the exam, you are allowed to practice in dentistry in Australia the way you want to. All right? There are no barriers in that. But because this exam wants to help you become that clinician up, that dentist once you finish the ADC exam. All right? So that's something. Please make sure that you listen to all these points and incorporate in your preparation, whether it's for the written exam or the practical exam. All right. Thank you so much and see you all soon again.